Guys, let's start biochemistry. So in biochemistry, we'll study sphingolipidosis, in which we'll study some enzymes. So I'll tell you some tricks so that you can easily memorize them. So first of all, we'll study GM1 gangliosidosis. In GM1 gangliosidosis, as you can see that there is characteristic facies. So characteristic facies in the sense we want to say like by looking at the child you can say that the child is suffering from GM1 gangliosidosis. So what are these? So first of all, one is frontal bossing, okay. Then second one is depressed nasal bridge. Then third one is long philtrum, that is philtrum which lies just below the nose and just above the lips, okay. And the fourth one is low set ears. So these are four things by which we can tell that the child is suffering from GM1 gangliosidosis. So in this there is first was frontal bossing, then depressed nasal bridge, then third was our long philtrum, and fourth one was our low set ears, okay. And the other features which are found in the GM1 gangliosidosis is, first of all, we can learn for is developmental delay. We can relate it with the frontal bossing just for memorizing, okay. And then blindness, as the child can't tell that he is blind, so we have to check. And then there is cherry red spot on the macula. Then deafness, we can relate it with the low set of ears. So basically there are three things involved: brain, eyes, in eyes blindness and the cherry red spot, and in the ears deafness, okay. So head, eyes and ears, so these three are involved, fine. And on the skin we can find the angiokeratomas, and internal organs are involved are liver and the spleen, so we can find hepatosplenomegaly. So and I also want to tell you that in which conditions you can find corneal clouding. So there are three conditions. First one is mucopolysaccharidosis, second one is GM1 gangliosidosis, and the third one is Febdis disease. Now next, let's move to Neem Pig disease. So in this we can learn like in the first of all we should know that in Neem Pig disease there is sphingomyelinase deficiency, fine. So just imagine that a guy named Nick or Nee, whatever you want to name it, okay. So the guy named Knee man, okay, he's sitting on the zebra to catch that to pick those cherry from the tree, okay. And on that zebra he had applied some springs, okay. And the spring denotes sphingomyelinase, okay. And the zebra denotes that in the Neem Pig disease we'll find zebra bodies. So through this image we can learn like first of all we should know that in Neem Pig disease is sphingomyelinase deficiency, and the other things we found is that we can find zebra bodies, okay. Then we found cherry red spot in the macula, okay. So these two are findings: zebra body and the cherry red spot in the macula, and the deficiency of sphingomyelinase deficiency, okay. Then now next now we'll study Febdis disease. So in the Febdis disease, as you can see a farmer standing, the farmer is signifies Febdis, okay. And as the farmer's duty is to produce cereals for us. So for cereal denotes ceramidase. In the Febdis disease there is ceramidase deficiency of the enzyme, okay. And in this in this image we can see that the farmer is crying as he have big painful swelling, like nodules on the joint. So he have swelling and nodules on the joint, so he's crying. So this disease, Febdis disease, resembles rheumatoid arthritis. So what we learned from this image is in the Febdis disease, we have enzyme deficiency, that is ceramidase deficiency. Okay, and what else finding we find? We got that there is painful swelling and nodules in the joint, which resembles like a rheumatoid arthritis. Now we'll study Woolman disease, also known as cholesterol ester storage disease. Okay, so in this picture, as you can see, there is a woolen sweater which is being washed, and from those, like we used to study in previous in our school, that when we wash, then there is some like micelles are formed. So it's like that. So we are considering that micelles is lipase, like there is micelles in that we find lipids and all. So it looks like a acid lipase. So in the Woolman disease or cholesterol ester storage disease, there is a deficiency of acid lipase. Okay, and first of all, it is not a Sphingolipdosis disease, it is a lysosomal disease. Okay, and we can also see that the man who wore this green sweater, okay, so he's suffering from this disease, and he's vomiting like anything. So in this Woolman disease, we'll find there is relentless vomiting and failure to thrive, and also he is having watery green diarrhea. This green sweater was made just to correlate with the watery green just for the green diarrhea. Okay, that is watery green diarrhea. And we can also see that his liver and spleen are involved. Hepatosplenomegaly is there, and we can see that the adrenals we'll find calcification, and that is the pathognomonic of this Woolman disease. Fine. So in this, what we learned is that Woolman disease is a lysosomal disease. Okay, and in this Woolman disease, we find there is deficiency of acid lipase, and in this condition, what happens is there is relentless vomiting, failure to thrive, green watery diarrhea, hepatosplenomegaly, and calcification of the adrenals. That is a pathognomonic feature of this condition. So three main things we should be clear, that first of all, it is in lysosomal disease, second, there is deficiency of acid lipase, and third one, pathognomonic condition, that is calcification of adrenals. Now let's move to Febdis disease. So Febdis disease is basically it happens in the man, as it is X-linked recessive disorder. Okay, and in this we can see like a man is standing, he is urinating, okay, he is micturating. Then what we can see that in his urine we'll find some Maltese cross. Okay, so the man who pee like this in the public area, so it's like a punishment. So some urine come on his body and on his eyes, so it leads to angiokeratoma on his body. Okay, what is angiokeratoma? Angiokeratoma is brownish, like brownish color stain on the something brownish on the skin. Okay, so so the person who pee in the public, so there will be punishment for him. So whenever he pee in the public, what happens, some of the urine come on his skin, which leads to angiokeratoma and hypohidrosis. Okay, and when it also comes in some of the urine drops come in his eyes, so he'll also have corneal whorls. Okay, and because he's doing like this, he's peeing in the public area, so there is a punishment. There is agonizing pain and inflammation in his proximal joint. So just imagine a man peeing in a public, okay, and his urine, and in his urine we can see Maltese cross. And when he is peeing, so some of the urine coming on the skin and on the eye, which is causing that angiokeratoma and hypohidrosis. And in the On the skin, angiokeratoma and hyperhidrosis, and on this eye it is causing corneal whorl, and in the proximal joint it is causing agonizing pain and inflammation. We can also find increase in the globotriacyl ceramide, and there is absence, and the enzyme which is deficient is alpha galactosidase. Okay, and the treatment is recombinant alpha galactosidase or L-galsidase beta or fabrazine. The second one is L-galsidase alpha. So this is up for the sphingolipidosis. If you like this video, please like, share and comment.